the EU MDR. We have challenges, especially for the population and cohorts, because it's a very niche population as well as the market, where the penetration is very less in India. Once we have approval, then we can go for abroad.
International Knowledge Millennium Conference 22 was organized in Hyderabad by International Knowledge Park, a life sciences incubator. At the 2 days event, startups were recognized for their work with awards. My Startup TV spoke to awardees on the sidelines of the event. Listen in.
Hi, I'm Rajesh Yadav, CEO of Aerobasis Innovations Private Limited. We are an IIT Hyderabad incubated startup. We are incubated at Center for Healthcare Entrepreneurship. We basically develop medical devices, smart medical devices for ICU care products. So our first device is Jeevan Light, what you see right in front of you. It's an adult and pediatric based ventilator which can be controlled from a distance. It has an IoT feature. That's a key feature that we required during COVID times. That's when we wanted the help from the doctors. When doctors are in close contact with the patients, they might get the contamination from them. So that's when we thought if we can control the device from a distance is what our overall idea was. We have a tab over here, 10-inch tab, which can be detached also and can be controlled from anywhere from nearby, or also if you want to control the whole system. In a rural setup, you have some doctors and there's a doctor, well-established, experienced doctor in city, and they want to control the system, see what is their exact current monitoring status. That also they can do it by logging into the system. That's a key feature. In terms of cost, we have placed ourselves at 4 lakhs. As we compared with respect to our competitors, they will be like costing around 15 lakhs. With that, we have 1/3 is the price is what we were, the major part, a novelty which you want to place. We are already deployed 65 units. So using support from USAID and other different partners, government partners like Department of Science and Technology, Department of Biotechnology and BIRAC. This is like a very ideal product for anyone who's from tier 2 cities. They have like very small bed size of 10 to 15 and they want to afford for upgrading their hospitals to as compared to a tier 1. That's a market which we have tapped in, which is a market which is not so far tapped in by the international brands. So because of the cost advantage, they are very keen to buy our units. That's why we have 200 plus pre-orders right now that we're currently working around to build the inventory and scaling up. That's our major goal in the next 6 months. We do have 3 products in our portfolio. This is the second device which we are working. The first one is the differential lung ventilation. That's the world's first differential lung ventilation. Though we consider lung as a single organ, there's like 2 different compartments. If one lung is infected more than the other, can we do it a differential way is what our hypothesis. With that, we did the initial set of product. It's almost an upgraded version of this, where you have 2 different flow rate, 2 different pressure, and then each lung can get different pressure. That's the first device. The third device is the JB Fit. It's like a smart vital monitor. It's like a watch which you can wear it. It will be able to collect SpO2 vital monitors, and that can be connected to a system. It will be like a full like feedback loop where the diagnosis will be done by the watch and the therapeutics will be given by the system. So that's like we're trying to tap into all this devices which is required for critical care. That's how we are trying to get into the market. So we are looking for raising $2 to $3 million at an evaluation of 100 crore. That's like next set of plan. This for increasing the scale up, where we have a target of around reaching 1,000 unit sale by end of 2023 and 2024. That's like we are part of a Mission Bharat program where we want to deploy this ICU care products in rural setup, so that the rural setup people who have these kind of problems, they don't have to be dependent on a tier 1 city. They have to travel all the way to a city. They lose their daily jobs. It's not just them, the relative also lose it. And they go to a burden of paying the loan. So those things can be dropped down if we can deploy these kind of units into a rural setup and enhance their quality of care. We are looking for CE certification. So we have finished almost 50% of the paperwork. We are now looking for it. So it will take around next 3 to 4 months to get the certification in process. And then we are open for European, Asian and African market. IKMC 2022 has been a great experience. We have been part of this IKP for a long time, and this is a great exposure for any startup like us at whatever stage you are, even prototype or in a commercial stage. It helps us to connect with the investors who are coming in, and also to pitch your ideas to new people who are looking to invest also. And also there are sometimes you also look for internships and someone who wants to join the company to also get an exposure. That's something which we are currently exploring. Let's see how things works out.
International Knowledge Millennium Conference 22 was organized in Hyderabad by International Knowledge Park, a life sciences incubator. At the 2 days event, startups were recognized for their work with awards. My Startup TV spoke to awardees on the sidelines of the event. Listen in.
Good evening, everyone. I am Professor Shomojit Roy. I am the co-founder of Solaire Initiative Private Limited. We are based out of Kolkata, Bengal, and we are incubated in West Bengal Webel BCCI Incubator at Salt Lake in Kolkata. Our product is an innovation. It's a very portable modular oxygen making device. As you know, during the COVID period, we developed it with our own science, our own deep science and technology. We developed the product. It saved millions of lives. So it solves the pain points in the oxygen industry. So at a time when our health system was outstretched, this innovation came in handy for our friends, for our near ones, and as well as the community in that region en masse. So which is a pleasure and a beauty, and that is priceless, because we think that healthcare should be affordable. And as Dr. Devi Shetty says, and my dad is also a medical doctor, according to them, if healthcare is not affordable, it's no healthcare at all. So our mission is to make healthcare affordable, portable, and take it to every household so that no lives are lost. So the cost of this right now is 30,000 rupees. We are giving a discount of 5,000, but we are also exploring tech transfer possibilities because, you know, we are scientists. So we want to do a tech transfer, and we have the vision that there will be 2 modules available. One is the cheaper, inexpensive one, which should be very less, and one high-end one with lot of beautiful add-ons like IoT implementation and Uber kind of implementation. And that will be a little bit expensive one. So we want to reduce the price, one below 10,000 segment and another one maybe 40-50,000 segment. So that's our vision. So it's a commercialized product, but now we have the market traction. If you Google, for example, Solaire OM Redox, you will have a lot of internet traction. And recently, I'm very happy to say that recently Honorable Prime Minister launched this product in Pragati Maidan, and the Science Minister also inaugurated this product. So it came under the innovation of 75 innovations in 75 years of independence, and that was an initiative initiated by BIRAC, which also connected us with the IKP knowledge platform. So we are now partnered with IKP, and we hope that we can take this innovation further so that if anyone needs oxygen, we want OM Redox to be a household name here or even in Mars. So we are in the process of nucleating that ecosystem. So this is our first product. We have several other products in the pipeline. So this product, we now want to do a tech transfer, layer by layer tech transfer. And that's where we are partnering with IKP because they have a lot of experience and expertise so as to make this scaled across continents, across the countries. And this will make the dream of Made in India come true at high innovation and high deep science tech space. So that's our business model. Basically, we want to license it across different countries. So we are having discussion with Bangladesh. We are also in the final stages of discussion with Webel, who is licensed. We are in the process of licensing it. So licensing is our model, and we have non-exclusive license. And we are also looking forward for partnership in southern India, meaning Hyderabad and around, because this is the most happening place so far as innovation, deep science is concerned. This has been an awesome experience. We are extremely thankful because we have come across an extremely talented set of people who cuts across the edges of expertise with legal knowledge as well as epistemology, which is a rare combination which we see in the IKP team, right from the CEO, right down to Harshata Vadkar and Bandhana. So we have an excellent team. They are working together seamlessly, and this has been a wonderful experience. We were able to connect with top people, decision makers, and we were also see the possibility of even nucleating a tech transfer right here in Hyderabad. So we are extremely pleased. We didn't expect so much. So we have our hands full, and we are very, very grateful to IKP as well as BIRAC for giving us this opportunity. I think this is a unique initiative, I would say, because my startup, what you are doing is really a platform. Because startups, what they look for platforms to be promoted. People who are doing startup, they are not doing it for revenue sake only. They are doing it because it's a passion, and they need facilitating platforms, because platforms are like yours, my startup, can make a difference, and they can really take the startups like ours to doors and across barriers, because nowadays people don't read newspapers. Everything happens on Twitter, on Facebook, in real time. And that's where seamless technology and seamlessly integrated platforms like my startup and similar initiatives can create a new ecosystem. They can become a new fourth pillar, so to speak, of this fabric where executive, legislature, and judiciary, if you consider them as three pillars, then these type of platforms can become the fourth pillar, and they can enable us, and they can reach us, take us to a different level. So I think it's a wonderful initiative, and we hope that we can also be part of this initiative and help each other and giving back to the society. That's also the dream, I think, of every startup owner or startup initiator, because at the bottom of our heart, we are trying to make India a better place to be. So it's a wonderful initiative, and thank you so much.
International Knowledge Millennium Conference 22 was organized in Hyderabad by International Knowledge Park, a life sciences incubator. At the 2 days event, startups were recognized for their work with awards. My Startup TV spoke to awardees on the sidelines of the event. Listen in.
I'm Dr. Nageshwarrao. I did a PhD in protein chemistry. So my company is Bicus Therapeutics. Bicus Therapeutics is started by University of Hyderabad's alumni. We are into some of the niche areas of biopharmaceuticals. We were working on the biosimilars in the rare diseases and some of the biosimilars which are not available in India and which are not affordable by the Indian patients. We have already commercialized 2 products. We have licensed the technology to Indian companies, and we are working more on other products which are in pipeline. So we are presently on the B2B. We are strong in R&D. We develop the technology, and the technology will be transferred to other companies. So this is fantastic. We have got opportunity to a lot of people, a lot of innovators and entrepreneurs and business people. So definitely this is a big experience for us.
Good morning. This is Rohan Tripathi. I'm the founder of iNovocare Health Sub Solutions Private Limited. Now, if any of you follow cricket regularly, you would have seen that this year during the IPL auctions, the auctioneer Hugh Edmundis had a fall, had a blackout and fell down. That is one of the symptoms of autonomic neuropathy. That is what we are trying to diagnose here. If you see that autonomic neuropathy has not one but many symptoms that tremendously degrade the general quality of life, and this increases a lot when you have diabetes, when you have old age, and even with some diseases like long COVID. So what we are doing here is we are recording your body's response when you are performing certain activities like change in posture, when you are doing activities like sustained hand grip, when you are doing a Valsalva maneuver, and we are comparing it with the medically set parameters results. We are following the Edwings et al. That has been accepted by the medical fraternity globally. The way we entered working into this was we had developed a very simple prototype of a head-up tiltability test for one of our mentors, Dr. Shamansdar, at the School of Tropical Medicine, Kolkata. Upon setting this up, we found out that the diagnostics required with that simple seesaw-like head-up tiltable test were severely lacking. After understanding that, we went to a lot of doctors for people involved in the medical education fraternity, and there we found out that a lot of doctors, they are saying, when we are asking them, do you think your patients, especially the diabetic people, must have this test done? They are saying yes. Then we ask them, how many of your patients have done it? Then they give us a smile. That's why we critically understood and tried to understand why this test is not happening. We examined the existing devices in this who are doing this partially. We found that one of the issues was the price was an issue, accessibility was an issue. Another issue was these devices are very bulky devices where the software runs in a separate PC or computer. That you can understand increases the price by 60-70,000. And if you think of the range of this problem, in India, the diabetic numbers are not a surprise to anyone. Even the elderly boom is absolutely at our doors. So that's why we think this is the time to look into this product. It's not about what I think, it's what the American Diabetes Association recommends. They're saying that for everyone with type 2 diabetes mellitus, everyone should have periodic testing of autonomic neuropathy. And even for the elderly, this is also critically required. Even these days, the doctors are saying for people who are rehabilitating or recovering from stroke, the stroke patients, to understand the quality of rehabilitation, this is required. Even these days, they are saying, the medical science is saying, that for the sports people, because the sports people have to go through a lot of checks to see their physical fitness is at the best levels. You can perform a yo-yo test to get your external fitness done, but what about your autonomic neuropathy? So for these responses, it's essential to have tests like this. Currently, we have completed the individual parameter testing successfully with a very positive result. We have received the bioignition grant, and up next we are heading towards the testing in the medical clinical setting with near about 100 patients in a hospital with a medical supervision. Currently, what we are planning to do is enter near the commercial stage, gather as much as data from the grants that we have raised using BIRAC Big and initially Nidhi Prayas. Once we have sufficient data, then definitely we will require a lot of funds, because for a medical device, the clearance and the diagnostics, and we don't want to be restricted only in India, so the international licensing also will require sufficient amount of money. There was a lot of interest, not only from the doctors, but also people in the medical research community. They showed significant amount of interest, and they even, as we are taking some time developing it, I frequently get contacted and calls, like, how far are you? Have you done it? Like in this upcoming 14th November is the World Diabetes Day. So yesterday only I got a call from one of the doctors who is one of our biggest supporters. Like, let's have a screening with your device on that day. I say, just wait a little, let us get some momentum, and then we will proceed. It was absolutely great attending the IKMC 2022. I have been here previously in IKMC 2019 as well. Last 2 years I attended the online versions, but being here physically, meeting the who's who of the medical innovation community, it has been just awesome. And also meeting a lot of my mentors here also. So it has been a great learning experience.
I'm Sandal Kotawala from Alphalius Technology Private Limited, and at Alphalius we have built world's first portable visual field perimeter. So essentially what this is it's a device for testing glaucoma. Now glaucoma is an eye disease from which almost 60 million people are affected worldwide, and it goes undiagnosed. So you may have glaucoma, right, in one of your eye, and since you open both your eyes, you may not realize that you have glaucoma. So until you get tested, you don't realize, and in fact 90% people goes undiagnosed. So what we have made is a test in a VR. It's essentially kind of a game where you can wear this VR headset and do a testing for glaucoma. And typically the traditional devices, they are big and bulky, costing about 25 lakh rupees. Right, and it takes almost 30 minutes for a test to complete for a patient. What we have done is we have made that 1/10 the cost of conventional device. So it's 1/10 the cost and it's 100 times portable. And it's way more comfortable for the patient. We worked with Arvind Eye Hospital and Johns Hopkins to validate it, and currently we have 100 plus users, 100 plus doctors who are already using it. More than 50,000 testing being done through our devices. We have an OEM who is doing it. Earlier we used to manufacture in Bangalore, but then we outsourced. As we were scaling up, we outsourced it to an OEM. And going forward, I think OEM based approach works best for us for the volumes we have. Yeah. The visual field perimeter market itself is about $500 million market in annual sales, and talking about other tests that can be incorporated. So the market is somewhere around $1 billion a year kind of revenue, and our strategy going forward is essentially to go device as a service, where instead of doctor having to pay for this device, he can pay per test utility, and that's what we are trying to raise about $500,000 to pilot and scale up that model. So far, since we have been mostly in India, we don't have, we are in process of getting CE. For the previous version, we had FDA 510K exemption, but for the current version, we don't have. So we are in process of getting those certification. Although we have a couple of users who are using as a demo device in US or a few in Africa. It has been amazing, especially, for example, there is this Dr. Abnisha in US, Moran Eye Center, and she's using these devices in the refugee camps. So people who are not a part of healthcare system, they can use device like this, and they can get benefited, who don't have healthcare there. And in Africa, of course, the pricing, it's a price sensitive market. So again, the response have been very good. So it was very personal experience. I was a glaucoma suspect. I went to Arvind Eye Hospital for an eye test, and then I realized the existing device is so difficult to use. It's so expensive. Moreover, it was never available for villages and outreach. So that was the motivation to make something portable and easy to use. And I'm proud. Like I've got a good team who helped me develop the entire thing. So I was more or less a developer, but now being an entrepreneur, you handle everything. Whatever it requires, you do that. So that's how it has been. Yeah, IKMC, it's been amazing. You find a lot of old folks you met probably 4 or 5 years ago, and they're back here. And also overall, the quality of sessions, right? The networking is good. The kind of people they're bringing in is amazing. The quality of sessions is great.
Hi, my name is Chandramouli. I'm the founder of Care Health Tech Services Private Limited. So what we are doing in Care is we are primarily trying to bridge the gap between the rural patients and the doctors in the city with the help of a health worker. So ideally, through our model, we'll be empowering ASHA workers, Anganwadi workers, or diagnostics center guys, or even a paramedic personnel with our mobile app, which will enable them to book appointments on behalf of the patients and connect them to the right specialists. So as you know, nearly 70% of the population in India lives in rural areas, and many of them do not have access to specialist doctors, right? So even in the primary healthcare centers, which are almost like 10 kilometers away, none of them have a proper doctor. And in community health centers, nearly 70% of them also don't have specialist doctors. So ideally, if somebody wants to have access in the rural area to get access to a specialist doctor, they need to travel almost close to 70 kilometers. So as you know, that is very difficult. On top of it, there are patient profiles like pregnant women, senior citizens, injured personnel. So they need specialists, and they can't even move an inch out of their house. So the idea is to help these kind of patients with the help of health workers. So we have built an app, mobile app. Basically through that app, as I said, they'll be able to consult with the senior specialists apart from that, the health workers can also bring out the vital details which is required for the doctor. Ideally, in a telemedicine, as you know, when it happens between the doctor and the patient, many times they don't have access to vital details like blood pressure, BP, sugar, and so on. But here, because the health worker is present with the patient, they can also provide all the details. So in that way, the kind of quality of care is improved and the accessibility is also provided along with the affordability. We are actually building a franchising model as of now, wherein we have identified in the rural setups diagnostic center guys or a pharmacy guys who have some background, and we are onboarding them with our platform. So we are giving them our platform as well as our doctors, specialist doctors, so that they can actually consult through our platform. So that's how we are doing. So we've recently started, so we are expanding in some of the pockets of Uttar Pradesh. We are focusing mainly on getting our platform integrated with the Ayushman Bharat Digital Mission. So as you know, like ABDM is one of the key initiatives of Government of India, where they are trying to build a healthcare record system for the patients across India, right? So we are actively working on that, through which we'll be able to directly work with the Government of India in creating Aadhaar IDs for the rural patients, and also be part of doing some direct assignments given by the Government of India. So that is going to be one source of income. The other is this franchising model, where we will identify some health workers on the ground and enable them through our platform. So the other model is, as you know, most of the target audiences are low income population. So ideally, we cannot actually charge them a lot of money for the treatment. So we are also working with foundations, wherein we are tying up through CSR models, where we are enabling our platform, or probably giving our technology platform to them, so that they can actually provide this healthcare through. So we are basically working on some model together and reaching out to these foundations to raise funds for the health programs. So we are working out different models. There are some clinics already in the rural pockets who doesn't have a technology. They primarily are doing either through WhatsApp or Zoom or video and so on. So they can also use our software, because it in the back end, as I said, we are integrated with ABDM, and it also maintains health records. We have access to vitals and everything. So we'll be able to also digitize their entire process through our platform. So I would say a small size HMR system is built in this entire app. So the software we built is it works both in a tab or a mobile phone, and even on a laptop, like if somebody wants to operate through a laptop. But ideally, what we have done is we assume that many of the patients in the rural areas do not have a smartphone, right? So that is the reason we are actually driving through the health workers. So ideally, it is the only health worker who will have the smartphone. It need not to be the patient who needs to carry a smartphone. Yeah. IKM, I've been actually associated with them through GenCare. So we are part of GenCare mission program. So through them we know IKM, and also through other colleagues and some of my previous connects. So I know about IKM, and that's how I was basically come to this event. So far the experience has been great. I've been actually made some very good connects here, and great networking has happened, and also met new friends. So that's the whole idea. So I think overall experience has been tremendous.
International Knowledge Millennium Conference 22 was organized in Hyderabad by International Knowledge Park, a life sciences incubator. At the 2 days event, startups were recognized for their work with awards. My Startup TV spoke to awardees on the sidelines of the event. Listen in.
Hi, my name is Dr.Mansukhmandaviya, and I am CEO and Chief Scientific Officer of UR Advanced Therapeutics. We are a group of academicians and industrial scientists which started this company. We are majorly focused on innovation, bringing innovation to India. And currently our first product that we have launched is a dynamic apoptosis detection kit. What it does is it identifies the dying cell. So if you are screening for n number of drugs to identify a drug which is specific for a specific cancer, you will screen for thousands of drugs, and you want an identification mechanism which drug of cancer. So there this kit is being used, and this kit is a competitor for a current global gold standard player which is Annexin 5, that is a 32 kilodalton protein. What we have developed is a 1.5 kilodalton small peptide. It is a single step process. You just add it to your cells and start observing the dying cells, and it can be used for facts, you can be using for imaging, or you can use by fluorimetry. So you can have a number of applications, and at the same time, being small, you can penetrate into deep tissue. That means you can image or screen for the cells that are deep inside your tissue for dying cells. Further to this, we have a few more products that are in line, which are again patented by us, and the next product is a exosome identification kit. The current method of doing exosome isolation is using ultracentrifugation or antibody-based precipitation. What we have identified is a pan-exosomal marker which can precipitate the cell exosomes from various cells or tissues, or even smallest volume of tissue like tear fluid. You can identify the exosomes, and thus we can go for a non-invasive diagnostic approaches using this. Currently, we just soft launched our one product, and we'll be in the market by Asia 2023. And in between time, we are supplying the kits to different market players as well as academics and industries, so that they get beta testing done. It will take another 3 months before we are commercialized in the market. So currently we are funding by ourselves, and we are looking for a strategic investor or like a long-term partner who can help us in achieving our bigger ambitions and goals.
Hello, good afternoon everybody. Myself Dr. Vikas Kumar Agarwal, cancer surgeon from Calcutta. Our product is MAPOT. All of us have felt pain in our life, and whenever the pain comes, the first thing is Ma or the mother. Similarly, the pain of cancer, I think whole world is aware about it. And pain of cancer is more with the chemotherapies, which is given injections multiple times, and the pain, ulcers, extravasation, a lot of complications are there, which is more than the pain of cancer. To relieve this cancer pain from the patient, we have a patented device, MAPOT, sutureless chemoport with the flexible flanges. They are the already imported ports which are available in the market in the range of 30 to 35,000, and which is very costly in the country like us, which have a diverse economy status. And cancer does not differentiate between a rich and poor. It can affect anybody. So to relieve the pain of chemotherapy in these patients, we have made a affordable, made in India and a patented sutureless chemoport. This device has multiple advantages, because in these old available devices, you need to fix it with a small sutures, and they can dislocate, they can migrate, the port can displace, and it is tedious process, painful to the patient. In our device, it is just like plug and just like a belt, you fasten it. So ease of placement, less painful, and ease of removal, less inflammation. The size is just like a size of a tablet, so it's very less discomforting to the patient. And the advantage of this chemoports, these can be used to draw the blood directly from the heart if the patient requires testing, which a cancer patient regularly requires. You can infuse medicines, and this can be punctured 2,000 times, and once you puncture it with a needle, you can keep the needle for 3 to 5 days. So the patient can complete the treatment for the whole lifetime. That is the advantage of MAPOT. For our clinical application, you can see we have migrated from these stages and we have reached to this final stage where our product is ready. Because it's an implantable device, it's a device which will be there in the body for more than 6 months. It becomes a type C medical device coming in contact with the blood. So we are now TRL 6 plus, everything molds and others are ready, the biocompatibility testing and a CDCO certification followed by ready to use. So the conventional therapies are given in the veins, okay, and the moment the chemotherapy goes in the vein, I'll show you a picture. The simplest thing which can happen is the vein get thrombosed. It's a painful hand, and now you can't give any more chemotherapy in this hand. So, and if the chemotherapy comes out of it, you can imagine what will happen. It will be an ulcer which will never heal. And with this kind of device, you can see the video, this is implanted inside. You can even go for the swimming and everything, nothing is outside. There is a different version between the vein lines and this central port are called a peripherally inserted central catheters, but those things lies outside. We in India have a risk of infection. Taking care of those are very difficult. Here you don't require any care. Once a month you go to your doctor, get your therapy or get it flushed. That's it. So, like a chronic kidney disease, we are a world capital of diabetes, which is leading to a huge number of chronic kidney cases, which requires a regular dialysis. So these patients, they have shunts in one hand, so you can't use that hand. One hand where we require some therapy. So in those who require long-term treatment, long-term nutrition, so GI disorder, where you require long-term IV total parenteral nutrition, the port can be used. So there are multiple uses. Apart from this, you can even use as in the different places where the necks are doing surgery. In that, if you require this, you can put it in the other large vein called a femoral vein and others. So there are multiple uses apart from the chemo also. So for the certifications and this, CDSCO certification, biocompatibility itself costs 20 lakhs. CDSCO will be in the range of 10 to 15 lakhs. And the CE and the FDA certification, because now we are India, which is looking not only for Make in India, but to export these to other countries, not only the ASEAN, even in the other countries. So CE and FDA would require another 25 to 30 lakhs. Apart from the industry manufacturing unit, so we are looking in the range of 5 to 10 CR so as to complete all legs. And the business opportunity is huge because we have seen a pandemic of COVID. Cancer is a pandemic. As per the data available in Google and everywhere, 1 in 10 men in India has a risk of cancer, 1 in 8 female. Already 15 lakh new cancer patients every year, and 70 to 80% requires chemotherapy. So the huge opportunity of the investor to get a hike in his investment from seed to series A or B, everybody will be benefited. The investment as a partnership in the company and 5 to 10 CR so that we can complete the leg. Half completion, even initial of 1 CR, and once we complete the leg, then they invest the further. That's okay. So it should be a. It is amazing. We are already a big Bharat grantee. So that was a huge support in the development phase. And after attending this, brushing a shoulder with those who's in the industry, those who have developed from innovation to a company, the words of wisdom and are huge, which has helped us in overcoming the hurdles, reducing the cost of biocompatibility, meeting the people who are into biocompatibility and testing and others. So that will be a great leap for us to move forward to market.
International Knowledge Millennium Conference 22 was organized in Hyderabad by International Knowledge Park, a life sciences incubator. At the 2 days event, startups were recognized for their work with awards. My Startup TV spoke to awardees on the sidelines of the event. Listen in.
Hi, I'm Komal Shah and I'm the founder of Ikshana Healthcare. This is a poster of our work. We are working on developing a treatment solution for women having urinary incontinence. So, urinary incontinence refers to a condition where you don't have control over urine flow. So, typically after childbirth or aging, or even women who have lung conditions can develop weakness in their pelvic floor muscles, and when these muscles become weak, it's difficult to control, basically to contract and relax the muscles the way they should be done for controlling urine itself. So for strengthening these muscles, it is possible to exercise. Just like any other muscle, you can exercise and strengthen them. For these also it's possible, but these muscles are deep seated inside the body. So it's not like your arm where you can see that you're bending enough and the exercise is happening correctly. So these muscles are inside the body. So about 40% of women are not able to do these exercises correctly. So the electrical stimulation is a known alternative where you give stimulation pulses, electrical pulses to these muscles, and the pulses will make the muscles contract and relax the way they should happen clinically. So here what we are doing is that we are putting the same electrical stimulation, the entire technology platform, into a wearable. The reason why we are doing this is because this treatment, it needs to be given multiple times a day, every day for several months at a stretch. So it's difficult for women to visit clinical setups, say to a physiotherapist or to a gynecologist for so many times every day, and naturally the compliance is very low. So that's the reason why we need something which they can use in a portable manner. There are other devices which can do the same thing. Like in India, we have Liberty by Utah Medicals, but they give electrical stimulation with an intravaginal device, which is not comfortable and to a large extent seen as a taboo in India. So what we are using are surface-based electrodes. It's just a wearable where you can, this is the line along which electrodes and other parts come in. These are integrated in the wearable, and it's very thin and it's very discreet. So that is the main USP of our device. The other aspect here is that women in general in India are not really aware that this situation can be cured. We've actually met more than 100, about 120 women, and we've spoken to them. And what we learned is a lot of them think that, my grandmother had it, my mother had it, so I was just expecting to get it. They just say that I'll put an alarm on my phone every 1 hour, I'll just go to the washroom. I won't let it collect, so, it won't really leak. But they don't realize that it's going to escalate in some time. If you don't pay attention to it, after some time, it's just going to escalate the condition, and then it'll be even more difficult to manage. So apart from coming up with the device, we also have a Ikshana community where we are trying to spread awareness about this condition. So as of now, we have 40 women part of the group, and we are hoping to grow further.
So at what stage is the product?
Yeah, so the platform is ready and we are doing some clinical validation tests. So this product, it actually started in IISc Bangalore, and the IISc Health Center itself, we have collaborated with them and we are doing some tests for the platform itself. The wearable is also ready, but we haven't started tests there. Recently, we got the Big Bhairav grant, and our plan is to start working with that grant towards first to make it fully compliant to medical standards, and to then take it out for pre-compliance testing and other aspects. But I think the clinical trial will require the maximum amount of funds, which we are looking to start in about 8 or 12 months from now. And we've already started preparing for that, and I think that will require huge funding because of the number of people who will have to be involved. Oh, it's been great actually. Even before this, IKP has helped us a lot to develop our work, and at every stage towards meeting with people and getting mentorship and other aspects. And to come here and to meet all of them together at once was also great. We've also attended a lot of workshops here, which have been very helpful. So there was one workshop on term sheets which we attended yesterday evening, and we didn't know a lot of these things, and to hear directly from someone who otherwise is on the other side of the table to understand what their perspective is very helpful.
Hello, my name is SK Dash and I am the Managing Director of Consital Life Sciences Private Limited, which focuses on botanical extracts and using it to validate drug discovery so that we target those illnesses which for which currently allopathic drugs are not adequate, or they don't actually sustain the entire spectrum of requirement that is supposed to be there. So currently we are working on eliminating malaria. So when people think about anti-malarial, we have gone that extra step, and as you know, WHO has mandated that by 2030 the entire the developing countries should eliminate malaria, and India happens to be number 4 in the burden ranking, and number 1, 2, 3 is obviously from Africa. So if we can just take down the top 10 countries, then 90% of our burden of malaria is eradicated. So till now, the government or the authorities, they were focusing on vector control. Vector control means the mosquito management part of it by fogging, anti-larval measures, but that's not adequate. What is required is the parasites remain hidden in the human liver and they are asymptomatic. So this facilitates the transmission. So if you want to eliminate malaria, then you got to cleanse the entire area, the endemic area that is harboring the parasite, by giving repeat dose of a safe anti-malarial. So that is why all anti-malarials cannot be used to take out malaria because they have side effects. But the one which we are developing is very safe, and it is nano encapsulated, and it is target delivered to go and hit the liver. And that is where at the initial stages the plasmodium multiplies. So if you take care of that, no more clinical signs of malaria, and also the residual parasite that is there in the reservoir, that also gets cleansed. So that's our part or our contribution towards eradication of malaria. So as I said, in the endemic areas, the people, they may be asymptomatic, they don't show signs of malaria, but they are very much harboring the parasite. So the parasite and the human host, they have a symbiotic relationship. So unless we cleanse that or sanitize that part of the liver which is harboring the parasite, we can't take out the entire or eliminate malaria. So the formulation that we have is actually can be given to any asymptomatic people, so-called healthy people, and they can take that. This can be given in pregnancy, it can be given to children, because it is botanical based and quite safe, well characterized. So that is how it can be mass deployed. We have already completed the preclinical phase. Now we have been covered by Big 16 of BIRAC. We have been funded, and thanks to BIRAC we are there. We have validated the proof of concept. Now we have to go to the human clinical trials, that is phase 1, phase 2, and that can only happen when we have additional set of funds. We are looking something like 3 to 4 crores, and that will take us up to the phase 3 clinical trial. So we are talking to different facilitators, funding organization, hoping to catch their attention. If currently the funding that we are looking for is available, then I think within 2 years' time, we should be in a position to roll out the product and commercialize that product. Since we have traveled this far, it's actually facilitated by IKP, and thanks to IKMC 22, so we are able to exhibit whatever our products are there, whatever technologies we have developed, our progress to the visiting dignitaries and people who are interested, and that way we hope to catch their attention and take our journey forward. So this is something which India has to do, because it has high malaria burden, number 1, and number 2, It's a sort of leadership that is looked forward from India for the African countries, and that is something which we should capitalize on. I mean, we should be encouraged through availability of funding, and that puts India into a space where you don't have to depend on artesunate. Today, artesunate, which is the present anti-malarial, has gone resistant. But we have done our tests at CCMB, Hyderabad, which shows that we are good to go even for resistant variety. So we are on the cusp of something good. And by the way, I can also say that malaria has fetched 2 Nobel Prizes. This is a product, and we are there who are giving alternative to artesunate. Maybe if not the Nobel, at least some great prize for this sort of discovery and recognition certainly accrues to us.
My name is Dr. Rekha Godbole. I am the co-founder and the director of a company called Gene Accurax Private Limited. This is based in Bangalore. We are a consortium of companies working together for the healthcare benefit. So I have been working in field of HIV, and for last 5 years I have been trying to develop a kit for HIV drug resistance. I have already developed one in-house kit which I have tested on 200 patients, and it was very helpful for the clinicians. But as we were doing the test, we found that this is not very affordable for many of the HIV patients, and also it takes a too longer time. So I am trying to develop a multiplex PCR kit, and we found that the commercial viability of that test is also a little not feasible. So now what we are trying to do is we are trying to work in 2 ways. One is we are working with NGS, where the cost will come sufficiently down, and also the turnaround time will be lesser. Secondly, we are working with microfluidics using a lamp technique, but that may take a little more time. So right now my focus is on NGS, and we'll be able to help the HIV patients as well as help the doctors to change the regime or decide which regime to use. Right now we are in the standardization stage, because we have just changed our angle a little bit. So it may take another 2 to 3 months to develop that. So I have got BIRAC funding for this, but we will need more funding to do validation and to actually get to the market. So maybe I'll look out for more funding from SIBRI or something, where we will be able to get to the market level. This is a wonderful event. I have met a lot of people. I have tried to build partnerships with some people, and also I've got a very good advice from the mentors. And IKP is generally wonderful because they are very friendly and useful, and they have always been there for my all difficult tasks to get sorted out.
Hi, this is Nalini. I'm a director for Levin Bakers Private Limited. We are making millet-based parathas made using fermentation technology, which is one of its kind. We are also in the process of patenting the technology. We are making millet-based parathas, which are currently not available in the market. And by using fermentation, we are able to make millets, enhance the taste and texture of millets, and make it more palatable to the modern customers. If you see today's modern days, making chapatis have become a cumbersome process for the modern customers, every household. It's also difficult for students to get healthy, nutritious food, and they have to depend on the local eateries and packed food, again compromising on their health and taste. So we have identified the problem to this solution. We have come up with more tasty, healthy chapatis, which is a better alternative to the homemade ones. And with fermentation, we have been able to increase and enhance the taste and texture of millets, because millet is again the food for future. We are all facing nutritional issues. Every kid, there are so many kids who are malnutrition. So even the government, we as an individual have to do something to combat this problem. And when we see millets was our ancestral food, and that time we didn't have so many lifestyle diseases, lifestyle problems. But after consuming the modern food more like rice and wheat, we have also started getting a lot of other problems. So now it's a time that we have to go back to our ancestors food. But again, then we are not used to eating millets. They are hard, they are brittle, it's very difficult to make millets. So we have come up with this solution. These are ready to eat. This is also soft, as good as the wheat parathas that we are used to, and also more palatable. It's tastier. With fermentation, we have been able to increase the shelf life naturally. It's 3 times more than what is available in the market without the use of any preservative. And with fermentation, there are more health benefits, like body is able to absorb more minerals, and also the nutritive profile gets better. It enhances. Like if you see, even the wheat parathas compared to a fermented wheat parathas have higher protein and less carbohydrates. And it is good for digestion, it is good for sugar management. So there are a lot of benefits with fermentation. Currently we have kept the prices very affordable, so that more and more customers are able to try the product. This we have tested 21 days, and it was good with all parameters. So it can last for 21 days in the refrigerator. Currently, we have done soft launch in different departments. Eventually, I want the customers to first recognize the brand, get used to the product, know that it's a good product, and the next step would be to put up in the various supermarkets. After that, we would definitely like to move beyond Hyderabad to other states, and maybe in the next 2 years, we would want to go global. These are just the basic products that we have come up with. We will be introducing more and more variants based on millets.
Hi, good evening. My name is Duke Chaudhary. I'm the marketing manager for the company called MicroGo. So we are into the space of hygiene and infection control solutions, providing to different healthcare sectors. So what we basically do is we buy out problems from different companies, especially the healthcare and the food industry, and we tackle their problems with our solutions, hygiene solutions, and give them digital solutions in the space of SaaS, right, where we give them smart, assured, sustainable and service. So what we do basically is we give them a smart solutions which is digitalized. We give them assured product which is scientifically being proved, as well as we give them sustainable, which is environmental sustainable as well as operational sustainable, and also give them a service which is basically trainings to the people who actually needs them. So so we have a complete ecosystem that we are trying to create for the space of hygiene and infection control, and bring out solve their problems according to their need, customize problems for their needs. So we are trying to create prevention in the space of hygiene, in the space of AMR, and in the space of One Health, where we are trying to create an ecosystem for creating a better food for people, for humans, or better lifestyle for humans. Also, along with that, giving them creating a better healthy ecosystem for animals as well as environment. Our products make sure that you get your health hygiene compliance complete 100%. Along with that, we can give customizable digital solutions, as well as digital aggregator of monitoring systems, or 100% real time data to which you can measure, which helps you measure your benefits, measure your hygiene protocols, and that way you can create an ecosystem which helps and create awareness across industries and give them a better space to evolve into the origin of the SaaS way. So that is what we are trying to do. We are trying to create this ecosystem for different in different industries actually, and give them a better solution for the upcoming future. So as of now, we have already got the Series B funding, and we are into the commercial space. So we are almost our turnover is almost going up somewhere around 40 crores right now, and we are trying to do as much as sales we can. So right now we are also evolving into different spaces and bringing in new products, a new product range, expanding our hands into poultry industries and exports, and certain expansion is already going on. We are also expanding our sales and marketing team. We are trying to grow in different other spaces, different places where we are not available as of now. So we have covered India into the zone 1 and the zone 2 basis. So zone 1 is the South India, which is mostly covered. Zone 2, we have only touched Delhi and Gujarat area.
I'm Rishikesh Kulkarni. I'm an electrical engineer at Upchiti. So we as a company are a tech company, and we build electric powertrains for all the micro mobility systems which we are concentrating right now. It may be low speed scooters, electric bicycles, skates, and all kinds of stuff. So we build the entire powertrain, and the parts could be battery management system, battery, motor controller, and all kinds of stuff. So as a first product, we have built a world's first battery management system in which you can charge your batteries with the help of any USB-C connectors that is already at your home. It might be laptop chargers, your mobile chargers, etc. So yeah, this will be helpful to us in a lot of ways. Like if you take these bicycles to your home, to your workplaces and all, you can just detach those batteries, treat it as your mobiles, laptops, so that you can just charge it, and then you can treat it like those things, and you can charge it at your table desk anywhere you want it. So yeah, the basic idea of charging your EV is no different to charging your laptop now is achieved, and we'd like to show a demo of this. If it is a 60 watt adapter, it starts to charge anywhere between 52 to 55 watts, so that it's not an overload on the adapter or on the battery pack side. So yeah, so taking care of all the thermal issues and everything, this BMS is smart enough to take care of all those things. We are currently working in B2B, working as a B2B in B2B sector. We are trying to get into a B2C sector. We still are not into revenues, but still the product is completely matured in order to go to production, and we are in talks with the battery manufacturers in order to test our product, and these BMS can be scaled up to scooters and all, electric scooters. So we are working on that also, and we have certain innovative things that is going on in the motor controller part also.
Hi, myself Pratima Solanki, and I'm a founder director of 3K Nano LLP. So our startup at AIC JNU Jawaharlal Nehru University, and we are making the biosensor for vitamin D3 detection, which is supported by Birect Bake. So in this regard, we are fabricating these strips for immobilization of your antibodies for detection of vitamin D3, 25 hydroxy vitamin D3. And then this is the second component of our biosensor, that is electronics device, which is under fabrication, which once we our electrodes will be ready, that will be connect with the electronics device, and we can easily check the vitamin D3 concentration into our blood sample in the form of the digital value. Second, as we know that nanomaterials have the very good the capacity to immobilize biomolecules. They provide high sensitivity as well as the more adsorption capacity of the biomolecules. In this regard, we are synthesizing various nanostructured materials, and basically this is the biosensing platform that how we developed it. So first, the sensing electrodes will be used to immobilize these nanomaterials, and then antibodies to be immobilized onto their top surface, and it will be connected with the electrochemical analyzer to check their electrochemical response. So nanomaterials which we have synthesized in our laboratory, we can also incorporate it in the form of the nanofibers, and we simultaneously we are making nanofibers of biopolymers like cellulose, and we can also synthesize these nanofibers on the basis of the customer requirement. They can purchase, some of the students laboratory based, their students, they are taking from us, and on their research purpose. So on the basis of the requirement, if anyone wants gives us some design, that we can also have some good facility for develop the 3D products in our lab. To all these knowledge we are spreading to students who are the interested to make our students. So we are conducting the workshop in our startup, and in like the 10 days or the 15 days to share their knowledge. So if anyone is interested, they can contact us. Like our website is www.3knano.com, and we are on LinkedIn. So please contact. So we are very thankful to IKP team, and they have invited us to participate in this exhibition. We are very happy. They have provided us very good space, and we have interacted so many new startups and the experienced persons. So we can connect with all these the startups here, and we are very happy to participate in this. Yeah, very good experience for us.
Hi, my name is Raghu Venkatesh. I'm co-founder of Answer Robotics, and my designation is Head of Business. We are based out of Bangalore. We are a 26-month-old startup. We started our company in middle of pandemic to help warehouses move faster, and we build autonomous mobile robots which can carry weight from 250 kgs to all the way to 1.25 tons. And the cool thing about our company is that it is completely indigenously made. It is a modular technology where any repair happens to a robot, you don't need an on-site operator to repair it. It can be automatically, you can have anybody just plug and play. And also a robot comes with features of autonomous navigation, where we have like LiDAR sensor and RGB camera and 3D cameras. Using the sensors, we do something called data fusing to understand the position of the robot. So once we know where the position of the robot is, all you have to do is that tell a task of a robot, like go pick this up or drop something. The robot will automatically plan a route, and just like your Uber cars, it will take your item from a point A to point B. So this is the problem we solve in warehouses or a factory floor, called as last mile delivery. So you can look at our robot, one of the robot which is over here. So we have like 3 models. So our lowest model is a 250 kg payload, and the last model is a 1250, which can carry up to 1250 kgs. And we started this company with a vision of saying that like we Indians innovate around the world, but India is not innovating. So we decided that we want to challenge ourselves, build a cutting edge product, and put India in the map of global map. So we build products which is made in India for the world. This kind of technology till today is only affordable by very large companies like Amazon or like multi-billion dollar companies. We want to enable small, medium enterprise companies which are based in India to get access to this cutting edge technology. So since our inception, we built 2 prototypes. Today we are in production, and we have finished market validation stage, and we went to market in March. In the last 6 months, we have generated revenue of 1.8 crores, and now we have a pipeline of more than 5 crores for potentially to close. And now we are at a growth stage, and our next plan is to set up a plant and start manufacturing robots and start helping Indian manufacturing and warehouses companies to ship or build their products faster. Our current customers is ARAPL. It's a company based in Pune where they do warehouse management. So we have built robots for them to help move material faster and more reliably. And our second type of customer is manufacturing customers, where they descriptive manufacturing customers. So the problem challenging they have over there is that when they have multiple production lines, the raw material has to reach at the right time at the right place. Even one raw material reaches on the wrong time, the whole production line is paused because the right material did not reach. So, but using robots, you can always ensure the right material reaches at the right time, and also you will not have a downtime. So, this is what makes us. These are the two use cases where our customers are using. In this exhibition, it's been very insightful. Our primary industry is manufacturing and warehouses, but this is a pharmaceutical exhibition. Over here, we have come to explore potential of how we can use robots inside pharmaceutical. One of the things we learned is that when people do clinical trials or work inside lab, they have a lot of repetitive workflows. So using our robots, they can automate those workflows. And second use case we found out was that when you have toxic material which has to be disposed, you can use robots to safely dispose from your working place to a disposable area. So it's been a very wonderful and meeting a lot of interesting people, and also we have learned a new industry. So thank you very much IKP for hosting us for this event.
I'm Rohit Asal, co-founder at Cambrian Bioworks. We primarily build reagents, kits, and workflow solutions for molecular diagnostics and genomic sequencing and genomics research. So the kind of products that we manufacture at Cambrian primarily enable researchers and clinicians in performing molecular diagnostics and genomics research activities. For example, if we take a case like cancer testing or cancer genomic testing, a lot of sub-components in the workflow make the actual test possible. Something like an early breast cancer test or a lung cancer test do not really happen just in one workflow. You need to be able to take the sample in a way that it stabilizes the DNA well. You need to be able to carry the sample from the sample collection situation to the lab effectively, and sometimes at room temperature. And then you should be able to extract the DNA really well using a good extraction protocol. And then further on, you'll have to build the sample and build the library in such a way that the sequencing happens in a certain expected manner. Now, all these sub components or sub pieces of the workflow will require different products at every stage. Now, Cambrian manufactures majority of these products in India in an effective price that is affordable, and a price that helps these companies scale up and really offer these tests at a much more wider method. Most of our consumers are B2B enterprises, meaning most of our products go into customers who are already into testing. Some popular names I could quote would be someone like a Metropolis, or someone who is very, very good in cancer testing. So any lab that performs testing using molecular diagnostics as a method will require products that we manufacture. So we are at revenue stage. We are 2 years old company. We've done decent revenues in the first and second year. Both years we are EBITDA positive. We are completely bootstrapped. We are not funded so far. We are now looking to raise funds to scale up our operations beyond India. So IKP has been a great partner for us in terms of using government funds, raising government funds, and connecting to the scientific community in India. IKP even today has seen a lot of people coming from CCMB, AIC, IITs, and a lot of academic background. So it was great to meet a lot of industry and academic professionals under one roof and talk about biotech as a primary conversation.
Hello, so I am Dr. Preeti Nigam Joshi. I am founder of Fast Sense Innovation. My company is involved with medical diagnostics. We are basically developing point-of-care detection assays for complex diseases like cancer, neonatal sepsis. We are currently at validation stage, and we are applying for the validation and different approvals from the CDSCO. Our next step is starting the trials, real samples and field trials, so that we can go for the test license and manufacturing license and get the product commercialized and manufacturing ready for the market ready product. We are targeting B2B, means our consumers are going to be doctors, healthcare professionals, PSCs, hospitals in rural and urban sector both. So we are targeting a range between 500 to 600 rupees per test, and we are bringing medical, you can say, the laboratory based diagnostic into point of care manner. So of course we are reducing the price also, so that it could reach to the masses, so that you can say the lower bottom of the pyramid. That is our that population we are targeting. This exhibition we have already, you can say, been there from the different previous year also, because IKP is our BIG partner. So I am coming from this exhibition before even 2017 also. So this exhibition is a great experience for me, for a networking perspective, to get new connects, to get mentors also. So I am very much satisfied with the IKMC conferences all the time.
Hi, my name is Arun Kumar Ramaswamy. I am the director and co-founder of Smart Home Healthcare Solutions. We are building Your Hub platform. It's an online physiotherapy and digital rehab platform where we want to take the physiotherapy from offline to online for certain conditions. Typically, when the patients do the physiotherapist exercises at home, they usually tend to forget the exercises, or they will not do the exercises correctly, so which elongates the recovery time. So what we are trying to do is we are building an AI platform where the patients, when they do the exercises at home in front of their own mobile camera, the camera will guide them, and it will also correct them if they are not doing the exercises correctly. So it ensures both correctness of the exercises as well as the completeness of the exercises, which helps in the recovery of the condition much better. And that's the platform that we are currently building. From a stage perspective, we are currently in the validation phase, where we have built the platform and we are testing it out with the trial initial set of patients. And once that's done, then we will roll it out to the general audience. So we have three types of consumers that we have planned out. The first one will be the corporates, where primarily to address the ergonomic concerns of the employees, where we are going to offer this as on a subscription basis to the corporates. Second will be the clinics or the hospitals, where they can offer this for the post-surgery patients. When the patients get discharged, this can be an additional offering that they can give it to the patients. And the third service will be directly to the patients, where the patients can directly opt for it. So there will be an initial consultation with the therapist, which will be live, where the therapist will see the patient, they'll do the assessment, and they'll assign the exercises. And after that, it's offline. After that, it's not live, where the patients will do the exercises in front of their mobile camera, and the mobile camera will guide them, and the mobile camera will give the live feedback in terms of whether they are doing the exercises correctly or not. It'll be a mobile app-based platform where the patients will switch on their mobile camera and they'll do the exercises in front of the camera. We have a sense of the current price that the patients pay for the treatments in the market. So we will offer it at a competitive or a slightly lesser price than what they are paying it today. We launched a startup 3 years back. We have one more platform before this. That's a clinical management platform, again for physiotherapy segment, due to which we have partnered with multiple clinics, and we have a good network of physiotherapists who are already partnering with us. And this is our second platform that we are building based on our network and based on the inputs from those existing customers. This event is a very nicely organized event, I would say. And it really helps in bringing the startups together and in showing the ecosystem, the strength of the ecosystem to the startups, the different types of help available, and basically it's a well organized and nice thought out event, I would say. Thank you so much.
Avishkaran, the bionest of Naipur. Hyderabad was inaugurated on the 16th Foundation Day of Naipur. On the sidelines of the event, My Startup TV spoke to founders of startups incubated at Avishkaran Bionest.
Hello everyone, I am Akanksha K from Naipur, Hyderabad, student of MS Pharm, Medicinal Chemistry, first year. I want to put one quote first. आवश्यकता आविष्कार की जननी है, right? So this quote really bringing innovations forward. We all are aware that cleaning and dusting cleans the object, right? But cleaning means that dust will harms us. So on the solution of this question, we have made a diamond broom. The name itself suggests diamond broom. Diamond means inverted umbrella. It will we can fix it on the rod so that while cleaning or dusting, we can collect the dust before it reaches us to harm. Our product is sustainable, customizable and multi-purpose, so that we can use any extensions for it, right? Like mopping, then wipers we can attach, and everything, the rod and every toolings available, these all are sustainable, so environment friendly. We are using the rod of steel, then extension that is diamond shaped inverted umbrella of cloth, so that it can be clean easily, and then the broom from broom comb, which is naturally available, so the whole product is sustainable and environment friendly. We are also try to cover the paint brushes making industry. We all know while painting, the drops of paints, everything will fall on ground, and it is very tough job to clean it. So it's better to just collect it on the umbrella, so that we cannot go through all that problems. So now only no need to buy multiple tools for cleaning. Only take one set, use it for every purposes in effective prices, and we will be covering whole broomstick market, and probably the paint brushes making industries also. Thank you so much.
Welcome viewers, welcome to My Startup TV, Founder Talk Show. We are at the Center for Innovation and Entrepreneurship at IIITH. We are here to talk to two founders who are incubated at the IIITH. Their startup is into it's called Deep Facts, and it is into medtech. The founders are Vamshi Karatam and Janardhan Sunkara. Welcome gentlemen, welcome to the show.
Thank you sir. Thank you sir.
So let's start by understanding what is medtech all about, or a deep fact all about.
So deep facts is all about most of the time cardiovascular patients or the cardiovascular events happen due to untimely intervention of the medical support. Yeah. So deep facts take care of multi-vital parameter device. It provides to the subjects, and so that if there is any event, immediately our command center will alert the attendant or the doctor, and as well as to the subjects, to take in timely intervention to save the subject from the medical any kind of uneven events.
So how do you monitor? Mm-hmm. How do you monitor your subjects that they are going through anomaly when it comes to health stats?
We have developed a multi-vital parameter monitoring device that will capture more than 16 vital parameters. For phase 1, we are giving 5 vital parameters, which is dealt by WHO. That is ECG, BP, temperature, heart rate and SpO2. The another USP is it will give abnormality alerts whenever it is required. While in one line, we are giving this platform for affordable and accessible care for everyone.
So do you have to wear this device?
Yes, we have to wear this on chest.
Vamshi,
yeah.
Today the way the iPhone, the phones, smartphones are kind of morphing. They are as good as becoming in some ways a device that checks parameters, health parameters, or keeps a track of it. Right from how many kilometers you've walked in a day to SP2O, ECG you can do it. So with that kind of thing, when you see smartphones kind of getting into that segment as well, the medtech state, where do you fit in?
See, coming to the Apple iWatch or the Samsung Watch or anyone, that's towards a fitness wearable, comes under that sector. Ours is more towards a medical grade, and here our device controls the pressures. See, normally whenever we wear it on the wrist, the wearable, it's controlled by us. So I can lose my watch, or I can tighten my watch. So these sensors mostly work on the pressure. So how far the sensor is from the skin.
Skin.
You can manipulate with the wearable watches. So there's a chance of the accuracy can be changed. In our case, what we do is when we put it on the chest, the adhesives and everything is controlled by us. The design is as per at what pressure or at what difference or the distance the sensor need to be there is controlled by our engineers, and we control that. So that's the main difference. One is that the accuracy will be increased because of this. And we don't it's more towards a medical grade, not towards the fitness grade.
I understand. Last night actually there was a medical emergency, and then I was going through it, and both of these devices were in play, where the iWatch and the SP2 monitor, and you could see the difference, because the watch requires you to keep your hand stable at a particular place, and as you said, where does it connect and all that. my question I was coming to was the way the smartphones or the smart devices coming up. It's only a matter of time where they would catch up with something what you're doing, right?
Yeah.
Because you can see what happened with iPhones when they started. They never had any of these components, but now today there's iWatch which does that, phone does it, and you were saying it is for the medical purpose, like medical grade.
Yeah.
So is it right to assume that your device would be used by somebody who has a problem vis-a-vis somebody who's fit? Because why would I wear it on my chest if I have no problem? I'm just kind of...
That's true. Yeah, again, I agree with you. See, it is mostly used for the elderly care, or the one who is having a cardiovascular history, or is a family history of cardiovascular. They can use it more of the time than the normal fit people. See, it's like, see, in India, more of the things happen. I mean, this is like the people are not proactive in the Indian scenarios. Then whenever there is an event, then only they get active, and then they think about having this kind of a devices or looking for this kind of a devices. But here the elderly care and the cardiovascular patients is the right sector what we are targeting at this time, and not for only for the fitness or the people.
And one more thing is, we can use it as a household device like BP apparatus and non-invasive glucose monitors. We are giving 5 key vital parameters. Anyone can use this for the general checkup. Kind of, if there is an abnormality, then you can go to your physician. You can use it as a general household device also.
That definitely that makes a lot of application kind of complete changes and makes it more. I think if not hard, definitely there are probably a family has one person who is suffering from diabetes.
Yes, there is a wide use cases. We are focusing on.
Yeah, that's true.
So currently you have a prototype in place, and are there subjects who are using this? And if yes, what kind of impact or what kind of results have you found?
See, our stage is not as a prototype, but we moved from the prototype to MVP, and we are going for a beta trials at this time with another around 100 devices. We are going to launch a beta version to the elderly care and to the cardiovascular patients. And coming to this, the accuracy of the device, we are standing from 90 to 95%. comparing with the standalone the ECG devices and the BP apparatus whatever available in the market.
And sorry to interrupt you. One proud thing is it's completely make in India device, chip and enclosure, everything.
That's remarkable. You know, we want to hear more of those.
That's true.
Make in India, you know, and for India, for the world. Make in India, but for the
for the world.
For the world. As a startup, okay, out of you, anyone who's a medical practitioner, any doctor? No. So how did you come up with this whole thought?
We both are mechanical engineers.
Okay. Wow. Mechanical engineers venturing into something to do with engineers, right? They don't do engineering. I mean, they do engineering and they get into something else altogether,
Yes,
right? And I think there is definitely an affinity between engineers and medical profession.
Yes, agree. Yeah. See, most of these devices or most of this medical equipment available in the market are done by engineers with the support of the
Inputs from the doctors and medical
researchers.
practitioners, yes.
That's how we have developed this device. We have around 14 doctors on board as an advisor.
We are just executors.
Yes,
The domain experts all are doctors. Without them, we can't do anything.
No, I
in this
understand,
medical
because they
sector.
bring subject matter expertise.
Yes.
You bring the technical know-how.
Correct.
So, one is to say that, you know, there is an anomaly and that gets triggered. It goes to a command center, and then you know somebody has a problem. What next after that? Do you have a solution after that?
Yes.
So that is where the criticality comes in, right?
Exactly. See, what we do is we identify the problem, we provide the solution. So in the command center, based on the data availability from the subject, if there is, I mean, in the command center, we are going to maintain some medical practitioners, like maybe the MBBS or ambulatory care, the basic ones who can identify and say this is the problem. So if required, we provide the ambulance service to reach their home and get them directly to the hospital.
It's a problem. It's a problem finder and solution provider.
So the problem is to find if there is an anomaly and then get them to the nearest hospital where they can be treated.
If you are identifying the problem, after that we need some action from our end.
True. So, are you raising fund, and if yes, what kind of funds you're looking for, and what that would be used for?
See, so till now what we have done was we bootstrap from everything.
Friends and family.
And we raised a little bit from friends and family, and few doctors invested into this into the company, and we are looking for nearly 2 million USD to scale it up in the bigger way. And before that, we want to raise it in trenches, not immediately. We don't need a 2 million, but to make sure we get the traction and scalability, we need around 1 million altogether.
Okay, tell us about your team, and who, I mean, you obviously two of your founders.
Yeah.
Who else is there in your team?
So we have a strategic director in our company. His name is Shesha M. Rao. He has done he has more than 25 plus years of experience, and he is from the IT background, and he worked with Wipro, and he has done a CEO for Inside Big company. Is Shesha M. Rao, and he is now he's a member of ICIA, Hyderabad Software Association, and he closely worked with us on the strategies and how to take it to the next level. He works with us, and we have good advisors from electronics. There's one Satyanarayana Garu, and he's from Osmania, and there's one by name Srinivas Murthy Garu, he's from Chennai, and he's more into advisory on the electronic part of it. And we have Dr. Suresh, ABS Suresh from Continental, who gives inputs on what level we need to take the device, and on the reporting side also we get more of inputs from Dr. Suresh. And it's almost like we have 15 plus team as advisors, consultants, and some are on board.
And we have good embedded team in house, Manoj, Dilip, and Shivram, Naimisha. We have good embedded team and software team in house.
So, to your best of knowledge, is there any other device that is or parallel product that is doing the same thing, and how do you compare to that?
So
be it India, be it abroad.
Yeah, there are some few devices, but they are particularly to one parameter or two parameters, not completely into 5 or whatever the next level 16 parameters what we are thinking. It's not into that. It's only into one parameter like ECG. We have Monitra, and we have one more called Vico Care. They are into the ECG monitoring called Holter monitoring. And we have BPL also is more into just particularly concentrating on one parameter, and we are more concentrating on multi-parameter to make sure it goes into the household model.
So anything when it comes to anything wearable, right? Like you're talking about even the watch, if it is not comfortable, we will loosen it, right?
Correct.
So a device that has to be worn. People have to be really comfortable with it. What kind of attention have you paid to the the design parameters of it, the economics of it, comfort part of it? You can talk about a little bit of the design and how what thought has gone into making it friendlier for somebody who's going to wear it all the time.
We have tested this MVP one with 30 females and 30 males. After that, we've done a design review. We completely concluded into small type of patch on the chest. It will completely wearable and comfortable for both men and women.
So it's going to be a patch.
Patch kind of.
Patch kind of. It's like a heart shape, which need to be placed here. And back we have an adhesives where just need to be fixed. Obviously, coming onto the body, if any third part, I mean like kind of watch or anything, there will be a small discomfort.
Yes.
Yeah, on the day ones, but slowly it can be used to it. See, our model is not to wear continuously. If required, they can use continuously. If not, they can use it on an episodic basis.
Okay. So basically, what you're saying is one can wear the patch, remove it as and when they require.
That's true.
Right? And somebody wants to wear it continuously. How does that? What happens when they take a shower? Even today, with people traveling, security checks at the airport, has a thought gone to that as well?
Yeah, obviously. So ours is, at this time we are going with IP65 grade, where they can take, it's a water resistant, they can take shower and things, but in the next level, what we have planned was IP67, where it can be fully waterproofed device. And
present is a rain proof, not a swimming pool proof.
Yeah. No, not as deep into. They can't go deep into the water. That's up to that we can take.
And then once you get into IP67,
yeah,
that should be able to do that. Right?
Yes, that's right. And security checks, the airport level, it can be handled. I mean, it's
we
doesn't make any.
We are making all certification from Central Drug Control and ISO 13485, IEC 60601.
The safety tests and everything is getting done on this. Then only it goes to the market, not immediately, but yeah, after the completion of safety, we take care of all the safeties like emissions and everything will be taken care. Then it will be moved towards the market.
So you are incubated with CIE, ITH. How has been your experience? How has the journey with them helped you in your own entrepreneurial journey when you're building the product and the business itself?
First of all, thanks to Ramesh sir.
Ramesh and Prakash sir, we need to thank them a lot because. They support us a lot on providing inputs towards the pitch or how to present to the investors and everywhere. Whenever we need, we just knock their door. They're going to give us time and
anything specific you can share as to how the association helped you in your design itself or product itself or conversation with investors. If you can be specific. Yeah.
So. Most of the design part was done at IIT Makers Lab, where it was headed by Dr. Prakash, and they supported a lot. And we used the same designers who have Deepak and everyone to get this design done. We sat with them. It's almost spent a lot of time and energies from them, and we got it design done here itself. And coming to Ramesh sir, he supported a lot on the other part of how to take it up. Every time when we face him, he asks Vamsi, when you are going to give us the use case. So use case. Vamsi used to ask us a lot on that. and still we are, because there are multiple use cases for this device. Coming up with the use case to Ramesh sir is very tough. Yeah, we're still in that process to go. Yeah, and we received Nidhi Prayas fund from IIITH to support our other device. We are working. It's an R&D goes on. We don't leave the R&D part. So we are coming up with one more device for more towards the cardiovascular patients. So for that we got funding from, we got a grant from Nidhi Prayas grant from IIITH.
Actually, this is right place for startups. Previously we are working in triple bedroom flat. After that we got a lot of changes compared to working in flat and working from CA IIIT. We have Makers Lab here, and suppose we have to do such kind of devices in the design point of view, it will take more than 6 months to 1 year.
Plus investment.
Plus investment and the travel efforts, more things there. In Makers Lab we are dealing with this Deepak and team. It's very comfortable and very output oriented community.
So, finally, MyStartup TV is a channel for entrepreneurs like you, and we cover your stories.
Yeah.
You know, what are your thoughts about us, what we do?
That's very nice. So you're going to reach us to take us to that audience, and that it may going to help us in all the ways. Yeah, not in one way. If some investor sees, they can approach us if they're interested, and if someone wants to try our device, it's going to reach them, and it's going to help us in a lot in the startups.
Definitely.
Yeah. I remember see your my startup in T-Hub, and that's really nice. Whatever you are doing is really a great job.
Jayesh Ranjan sir also there in particular event in T-Hub. So what is that event with KTR?
Oh, okay, I'm not sure.
Or T-Hub 2.1.
Yeah.
We had about first time in my startup TV. We said, wow, this is TV for startups.
Yes, that's true.
It's fantastic actually.
Thank you, gentlemen. Thank you for being on our show.
Thank you very much.
Thank you so much.
Yeah. Yes.
Avishkaran, the Bionest of Naiper. Hyderabad was inaugurated on the 16th Foundation Day of Naiper. On the sidelines of the event, My Startup TV spoke to founders of startups incubated at Avishkaran Bionest.
There is no drug utilization review, which is most important thing, which is lacking in the present healthcare system, that's in the pharmacy based. And we at the doctor's pharmacy, we look at the drug utilization review. That is mostly important for the patient betterment, such as drug interactions between drug-drug interaction, drug-disease interaction, and drug-patient. That's with drug-food interaction, which is lacking. And that should be, we should be concentrating more on that. And we being a pharmacist, that is the most important thing what we're doing with the patients. And we're doing in the form of the counseling and providing them data and checking on the patients about the compliance, whether how they're doing, and also reminding them of the refills to start a digital health. And that's for the comprehensive health care. Vision is transform the digital care, that is comprehensive to provide the delivering the care. That's a comprehensive way to the building the healthy communities. So that is my main vision. We at Doctor's Pharmacy, we look at that, we look into the patient's profile, we give them the information, we talk to them, we counsel them, we are for them. Basically, our concept is not just dispensing the medicines, we are dispensing the care. They need not go to the hospital, they can get the right care at the pharmacy itself, because that is a place where the pharmacists are the point of care for the patients. And this is we are doing it at the Doctor's Pharmacy right now. I've started a retail store a year and a half back, and we've been doing all these services in all the communities, and right now we are concentrating more on more communities to build the healthy communities, I can say, and this is through our e-commerce. And where is in the pharma sector right now, especially in the retail sector, where I'm running a retail store as well as an online pharmacy. We have right now a couple of physical stores and also online. And at this moment, and I'm running the retail store for the last 1.5 years and starting my mobile app in another 3 to 4 weeks. and which they're only concentrating on dispensing the medicines. But my concept and my vision is to dispense the care to all the communities. And whereas I'm coming up with building healthy communities, and this is in the rural as well as urban areas, for the comprehensive healthcare system, for the betterment and for overall healthcare of my patients. First of all, I would like to congratulate Avishkaran for the first cohort for the startups, and it's a wonderful journey for me as well. And this is my team, the entire team of Doctors Pharmacy.
Dr. Manish Diwan, BBT Bairak, addresses the Avishkaran inaugural event. Listen in.
Very good afternoon to everybody, and congratulations on the 16th Foundation Day. I'm really blessed to be part of this momentous occasion with all of you. Director ma'am, Madam Secretary, and faculty, entrepreneurs. I can see some faces, old good friends who are supporting the ecosystem, investors, the Bionest incubator across the city and different dimensions. Some of the startups we could interact, spend a little bit of time, and a lot of young minds sitting at the back, the young students who are pursuing UG, PG, doctoral or postdoctoral studies. I think pharmacy institution like this, who has actually, let me put one more thing here, I would say, not many IDPL facilities would have got blessed with such an establishment. It is a great tribute to that endeavor which was set in several years ago, where now a permanent facility of educational center and a center of excellence in pharmacy, which is now prospering. So IDPL soul would be kind of blessing this endeavor because of all of you. Pharmacy is very interdisciplinary and inherently translational. So unlike many other science streams where you actually have to kind of encourage people to start looking what could be the outcome of the basic sciences outside the laboratories, how you can translate the knowledge that is generated in those research institutions and can help societal unmet needs. But pharmacy is inherently driven and sitting at the translational space, and it has a wide variety, a great expanse of different domains within the pharmacy, from pharmacology to pharmacognosy, delivering the drugs with pharmacokinetics, chemistry intertwining with with all streams, chemical synthesis to NMEs. And even after the delivery, the pharmacovigilance, it's a fairly wide spectrum. And all of you who are getting training under specific domains, right from discovery, understanding the anatomy sciences, to actually in the marketing domains, actually considering how to get integrated with the markets once the product is panned out from all the efforts. So, and pharmacy is one sector where it can actually contribute to many unmet needs and the emerging global challenges. We were just talking about and all of us would have experienced the last 2 years of pandemic. The health sector and the health got immense focus from non-science people, from policy makers, economists, the world at large. All the economies of both developing nations as well as developed countries, the infrastructure was all challenged just because of one pandemic. And I think we are sitting right in the center of the entire activity from this NIPER pharmaceutical institute to be able to relate to those gaps and be able to contribute in that segment. We would have all heard about unicorns, and unicorn. Anybody like any time when your valuation increases and breaches that 1 billion benchmark, you are entitled to be called as unicorn. That is all reflecting of the new innovation, new businesses getting set up. Biotech sector, including pharma, biopharma, we do not have much presence of in the unicorn space. There are only 4 unicorns which are from the pharma space, all in the kind of delivery space, but not in the core deep tech area. But these numbers are increasing, as we all relate to. India is the largest, third largest country of startups. So that means a lot of innovation happening. More than 65,000 startups are registered in India. We have 44 unicorns panned out last year and graduated to the unicorn status. As year has passed, so we have now reached to 107 unicorns from India. So this number is increasing, and I think this puts a focus and a scope and a potential for a place like this, Avishkaran, as an incubation center to nurture such new startups who can possibly potentially go and reach to that landmark. India's pharma sector, I was doing it just about very small amount of groundwork, but I could see that most of our pharma companies currently, their valuations are just about $4 to $5 billion. The topmost country's pharma company has a valuation of about $20 billion, which is less than 1 quarter revenue of one of the major immense innovator pharma companies outside India, global pharma. So I think the very reason we don't have much higher valuation within our pharma belt is that the innovation component, we have kind of let it slip. We are not investing enough in the R&D, in the discovery and innovations, in the first-in-class discoveries. We are more into me too, best-in-class, and follow-through. I think time has come where the intensity of competition has bridged the gap of geographical boundaries. The solutions which get nurtured or developed anywhere across the globe, they get adopted and they get implemented, whether it is India's company or outside India's company. So this is a stage where innovations done here in the country would have a platform to compete and contribute not only for India but for the world. So Atmanirbhar Bharat, which has been the national drive, Honorable Prime Minister ji has been pursuing, I think the Startup India, Make in India, all these national missions are platforms which have been seeded to help progress India and build that innovation quotient. And everybody is banking upon this young talent, young mind and young pool which is graduating. Honorable Secretary Ma'am shared one insight that they are already thinking in how to spur more innovative ideas to fund and support beyond the educational curriculum. So I think there is a thinking in that direction. BIREX existing enabling facilities both for funding, incubation and mentorship and the vast expanse of network that is also available to each and every single individual startup as well as industry. The Avishkaran, which was kindly inaugurated today, by ma'am, that provides a nurturing ground for such innovative ideas where each one of you can actually utilize that opportunity, be it as a full-time dedicated entrepreneur or as a as a as a uh, as a temporary or transient scouting of the activities which are happening, because that would become a center of place of network where people from across different dimensions would like to come and congregate. And beyond our I am also from a pharmacy background, so I know it's morning till late evening classes, one after another, practicals. So we hardly get enough time to look outside our classrooms or outside our peer group. But I think within the campus, when you got that opportunity, kindly utilize that. The network of incubation center within the vicinity, within Hyderabad itself or around, we have 7 BioNest incubators, and in the state we have, in the Hyderabad itself, it is close to 45 incubators as of now. So it offers an immense potential